Hi guys, I am Diana Villamar and I am going to talk about emphysematous cystitis. Definition. Emphysematous cystitis is rare infection disease characterized by the presence of gas bud inside the bladder and in the water bud, processed by the presence of mainly gas-forming aerobic gram-negative bacilli. It has a low incidence. It generally occurs in diabetic patients. It can be asymptomatic or go into a severe state of septic shock. Applications in medicine. Given the non-specific of the symptoms, a diagnosis of this entity is usually really be performing an imaging test. Plain abdominal radiography may reveal the presence of a equivalent halo surrounding the bladder. We can look hot intraluminary air, but it is not non-specific. Ultrasound can demonstrate bladder parietal thickening with hypertrophic lines. The most reliable imaging test is CT, which defines the extent, severity, and organs affected, and allows ruling of other possible causes of gas in the lower urinary tract.
Cystitis, also known as the inferior urinary tract infection, is the inflammation of the bladder. Cystitis is more common in women because women's urethra is shorter than men's urethra and it is closer to the anus. The urethra is the last tubular structure of the urinary tract that conducts the urine from the bladder to the outside of the body. Women's urethra is about 4 centimeters long. Men's urethra is about 15 to 25 centimeters long. The most common cause of acute cystitis is bacterial infection, in many cases caused by a bacterium called Escherichia coli. Normally, the urinary tract is sterile. Sometimes bacteria from the skin can get into the urethra and migrate back up the urinary tract, causing urinary tract infections. The most important contributing factors are constipation, sex, low fluid intake, cold. Clinical symptoms include pollakiuria, which is an abnormally frequent urination, dysuria, which is pain or a burning sensation during urination, pain in the inferior abdominal region, cloudy urine, hematuria, meaning blood in urine, but this symptom is rare in cystitis. Fever is not a common symptom for cystitis. Your doctor might indicate a urine culture, which is a test that identifies the bacteria that caused cystitis. It is very important not to take any antibiotics before the urine culture, as this may lead to false negative results. This is how you should collect a urine sample. First, wash your hands and then your genitalia. Then collect some midstream urine, approximately half full of the sterile container that you will receive, and take it to the laboratory analysis. The urine culture is usually associated with susceptibility testing to see which antibiotics will inhibit the development of the bacteria causing the infection. The result of urine culture is normally ready in 2 to 3 days. Because in these 2 or 3 days it is not known for sure which are the bacteria that cause the infection nor the right antibiotic, the doctor will indicate empirical treatment. Empirical treatment is the treatment prescribed before the definitive diagnosis is established based on doctor's medical observation and experience. After the result is ready, the doctor will indicate the most appropriate antibiotic for the infection. In some cases, the infection may progress with spontaneous healing. Most of urinary tract infections can be easily treated if they are addressed in time. If not addressed in time, complications may occur, such as the spread of the infection to the kidneys. This is why early diagnosis and treatment are so important.
Pros and cons. It does not have pros and cons, but it does have risk factors. Myelitis diabetes, family gender, urinary tract obstruction, narrow bladder, rectal gallbladder fistula, urinary catheter placement.
Cystitis, or inflammation of the bladder and the urethra, that's the tube that your wee comes out of, is caused by a bacterial infection. Germs that normally live harmlessly either in your bowel or on the outside of your vagina can pass up that tube, which is much shorter in women than it is in men, and get into the bladder where they can multiply, leading to symptoms. It's more common if you get dehydrated. It's more common after sex because of all that rubbing around, and it's more common in women who've gone through the menopause because the vagina and the tissues around it can get dry, making it easier for germs to penetrate.
Issue applied in Ecuador. According to the INET in Ecuador 2009, urinary tract infections represent the 10.3 of diseases in women. This disease most commonly affects elderly, diabetic, and immunocompromised patients.
Guys, this is Mubin. We are talking about uncomplicated cystitis and its management. You can establish uncomplicated cystitis by the following. Number 1, dysuria or burning micturition or discomfort in micturition, high frequency of micturition, suprapubic discomfort without any flank pains, no unusual vaginal discharge, no high-risk sexual behavior, and presence of bacteriuria or pyuria on urinalysis. In such cases, further urinary cultures are not necessary. You can start the patient on trimethoprim sulfamethoxazole. Now, as a bonus, bacteriuria is defined as classic definition 5+, which is 100,000 colony forming units per milliliter, and pyuria is greater than 10 WBCs. So thank you very much. One more point, presence of nitrites is an indication of urinary pathogens. However, absence of nitrites does not rule out urinary pathogens. Guys, thank you very much for watching this video. Make sure that you like and subscribe, and if possible,
And conclusion. Emphysematous cystitis is rare. The diagnosis is established with plain radiographic computed tomography offer better results, but is more expensive. Patients with few comorbidities and respond favorably to conservative management, while patients with necrotizing infection require more aggressive treatment, including surgical procedures that can include drainage. parted cystitis or even simple cystectomy.
मैं मिसेस लता अरोड़ा फ्रॉम दिल्ली और मैं लास्ट 8 इयर्स से इंटरस्टिशियल सिस्टाइटिस से पीड़ित हूँ और इसका मैंने हर जगह इलाज करवाया है कि मेरी डे टू डे लाइफ जो है ना इतनी डिटोरिएटेड हो गई थी कि मतलब कई बार तो ज़िंदगी बिल्कुल हेल लगने लगी थी। मैंने कोई भी ट्रीटमेंट नहीं छोड़ा पोलो हॉस्पिटल का और उनका लिखा हुआ था कि इंटरस्टिशियल सिस्टाइटिस में ही इज़ अ परफेक्ट पर्सन और ये चेयर पर्सन भी हैं तो टीम के साथ और देख लीजिए मैं 5-6 दिन के अंदर मेरी ये प्रॉब्लम से मेरे को निजात मिल गई है और मेरा दर्द तो बिल्कुल ही खत्म हो गया है जहाँ मेरे को रहता था। बाकी हाँ, सर्जरी इतनी मेजर सर्जरी है तो जो लोग इंटरस्टिशियल सिस्टाइटिस से पीड़ित हैं और जिनको कोई रास्ता नहीं मिल रहा है, प्लीज 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 आप ये डॉक्टर राजेश तनेजा जी के पास जरूर आइए। इज वेरी नाइस पर्सन, ये तो समझो भगवान के अवतार हैं और ये आपकी सारी प्रॉब्लम जो है ना बहुत आसानी से बहुत प्यार से सॉर्ट आउट कर देंगे। थैंक यू।
हेलो, मैं डॉक्टर राजेश तनेजा, सीनियर कंसल्टेंट यूरोलॉजी एंड रोबोटिक सर्जरी, इंद्रप्रस्थ अपोलो हॉस्पिटल, नई दिल्ली से बोल रहा हूँ। तो ये पेशेंट है हमारी मिसेस लता और ये कम से कम नहीं तो 10 साल से परेशान है। इनके ब्लैडर में एक बीमारी होती है इंटरस्टिशियल सिस्टाइटिस, वो बीमारी थी। उसका इन्होंने बहुत जगह इलाज कराया लेकिन वो बीमारी प्रोग्रेस करती गई और अब हालत ये हो गई थी कि वो ब्लैडर जो है, जो नॉर्मली पेशाब की थैली 500 ग्राम स्टोर कर सकती है, इनकी पेशाब की थैली जो थी वो 20-25 ग्राम ही स्टोर कर सकती थी। एज ए रिजल्ट कि हर 10-15 मिनट में इनको यूरिन में जाना पड़ता था बाथरूम की वजह से। पेशाब का रास्ता अलग से बनाया और अभी चली गई हैं घर, बिल्कुल ठीक है और शी सो हैप्पी क्योंकि अब ये रात को सो सकती हैं। घर में आम लोगों की तरह ये घर की बाकी एक्टिविटीज़ में काम कर सकती हैं, हिस्सा ले सकती हैं, पिकनिक जा सकती हैं, कुकिंग कर सकती हैं और अब इनको दर्द बिल्कुल नहीं है। थैंक यू वेरी मच।